Meanwhile, state workers may soon have to pay more for their health insurance.
A state insurance board voted to add deductibles and raise the out-of-pocket costs for employees. Valina Jones is in the newsroom with more on the plan, which was also just approved by the JFC. Valina?
Susan and Eric, state workers will be required to pay more out-of-pocket health care costs starting next year, but they could opt out of taking state-subsidized health insurance for $2,000. That option passed by the Joint Finance Committee. The state could save up to $18 million, depending on how many employees take the deal. The vote comes after the State Department of Employee Trust Funds Group Insurance Board voted 9-2 today on a proposal that will cut $85 million over the next 2 years. That means increases in co-payments, deductibles, and drug costs. The group says it's all to meet Governor Walker's proposed budget that calls for around $80 million in savings on health care coverage.
It is challenging because you want to balance the needs of the state and the budgetary constraints it have, also with the employees themselves where the impacts fall.
In Wisconsin, we enjoy a level of life that we can support our families and we can feel safe and secure. What they did this morning, there will be thousands of state employees that will wake up and wonder whether they can provide health care for their families and themselves in the future.
Now, the majority of state employees do not pay deductibles for health insurance. Under the proposal, they would pay $250 a year. Annual maximum out-of-pocket costs would also go up from $500 to $1,000. Both amounts would double for families. And I talked to almost a dozen state workers today who said they're not only frustrated, but are worried about the impacts to come from health care increases. They all declined to go on camera for fear of losing their jobs.
Valina Jones in the newsroom. Valina, thanks.